Well, so this all started about 11 years ago when I was 19. All of a sudden I was noticing some swelling in my left rib and it was really painful. And so doctors had done some tests and my ANA level was elevated a little bit. So they sent me up to the University of Utah to their rheumatology clinic because they were thinking it was lupus. And so I started being treated for all of that. And the medicine wasn't working, and then they tested my blood work again, and the ANA levels had dropped back down. So they decided it's not lupus, but they knew at the time that it was an autoimmune related disease. They just weren't sure what, because I wasn't fitting into exact categories of for lupus, fibromyalgia, rheumatoid arthritis, all those. And then the medicine wasn't working. Long trials of steroid therapy, methotrexate, bunch of infusions, nothing was working. And finally, they kind of discovered this SAPHO syndrome, which is the SAPHO, that's very rare, very hard to diagnose. And it wasn't until 2 years ago that they really decided to go aggressively in treatment with it. Up until that point, it was just treating for pain because nothing was working. So at that time, it was a high dose of methotrexate, again, combined with Remicade infusions. And I did that for about 3 to 4 months with no improvement whatsoever. It wasn't any change, any difference that I could notice at all. And with the SAPHO, what's tricky about it is I don't actually present all 5 of the acronyms. I present the S, the H, and the O, which is I get them so mixed up. The synovitis, the hyperostosis, and the osteoporosis, which basically deals with extra bone growth and sensitivity. And that's what's been going on in this left rib of mine. And every time it flared up, it was always the same place, same type of pain, sharp stabbing, and it would come as quickly as it would go. And over the years, I'd have breaks. I'd get a flare maybe every 3 to 5 weeks, and they'd last maybe, I don't know, a week, 2 weeks. It's been known to last as long as 6 weeks. That's not unheard of. And that was kind of my life, except for 2 years ago, and all of a sudden I stopped getting breaks. So it was just constant flare, 24/7 pain. And with the methotrexate and Remicade not working, their only other option was if we can get a surgeon to maybe remove part of that bone in the rib. The idea being, you know, there was a case study where somebody had an extra bone growth on their arm and they got that part removed and felt better instantly. The tricky part was they read with SAPHO, if you do something like that, it can come back and it can attack even harder somewhere different. So that was a concern, but at that point I was going, I'm done with this. So November 2015 is when, by some miracle, I got a surgeon to be willing to cut me open and remove part of my rib. And so he'd gone and done that. He'd taken out a little more than he said he would. It was about that much of the 7th rib that's missing now. And when he pulled it out, it looked completely healthy. No infection, nothing wrong with it. But when pathology came back, there was staph hiding deep inside the bone. So they put a PICC line in, treated me for staph infection on top of everything, in hopes that that would take care of it. And I was really well, the best I'd been for 2 weeks since the surgery. And then the fever started to come and pain started to come back. And I was so tired and not feeling very well. But we'd done all sorts of bone scans. We did a white blood cell scan to check for any type of infection, and they couldn't find it. Mind you, they didn't know there was infection beforehand either. And that kind of geared them going, maybe it isn't SAPHO, we're not sure, because that was the trick, was with SAPHO, it can look infected when in fact it's not. Whereas when they removed part of the rib, it didn't look infected, and it was. So they kind of stepped back a little bit, not sure. They didn't discount it, but they weren't as certain, I guess, with this SAPHO syndrome. But nonetheless, they sent me on my way, and tried doing, did some other tests. I did nerve ablations that didn't work. And again, more treating for the pain. That was the biggest thing. And then in June of this last summer, 2016, all of a sudden the pain got so bad that I couldn't move and I couldn't get out of my bed. And I was that way for 4 weeks. I didn't come downstairs. I couldn't shower by myself. Everything, I was either crawling or holding onto walls to walk because I couldn't do it. I didn't have the strength. It hurt too bad. And I couldn't do anything on my own anymore. I couldn't get dressed by myself. And finally, after 4 weeks of going, this isn't getting any better, I went back to the hospital. I got admitted, and this hospitalist came in, took over my case, and he said, I'm very confident that what's going on right now is neuropathy and in my ribs. And they did play around. It could be caused from anything. It could be from a virus, from medications I was on, or it could have been from my surgery. So after talking to some other doctors, it's more likely that when the surgeon went in to cut out part of my rib, he had gone in and tried to kill off the nerves around it to stop the pain so that I would be good. And by doing that, it actually damaged the nerves around that area and has left me with permanent nerve damage. So it's something I'll have the rest of my life and have to be treated with, they use it with anti-seizure meds. And so that's what I've been dealing with since. And I've had to relearn how to walk with physical therapy 3 times a week, from walkers, working with canes, trying to get my strength and balance back, and that's been since July. And here it is, almost November, and still using a walker, still can't go anywhere without it hurting. It's very sensitive, and my voice would go. But I think the anti-seizure meds have helped my voice come back a little bit. But that's the general sense of what's been going on. And when you think of neuropathy, most people think diabetic in your feet, or more of it being in your arms and legs from like carpal tunnel syndrome or things like that. And so for it to be in my ribs is pretty rare, but also harder to treat because it's not acting like a typical neuropathy patient. I'm a very atypical patient in everything. I've tried looking into someone else that's similar, and I can't find anybody. And the doctors seem to not have any patients with similar experience. It's anyone that would, it's so cut and dry of, well, they have lupus, they have fibromyalgia, they have rheumatoid arthritis, and I seem to have a little bit of each disease's symptoms going on. And I would love to find somebody that was experienced, because I'd like to know what they'd tried that seemed to work for them. You know, there a lot of people that I know have autoimmune issues have been on methotrexate before, prednisone, and those type of meds, and they're awful meds. I mean, methotrexate is a cancer pill, it's a chemo, and that you can experience hair loss, and I did. Not noticeable, you know, but I just fall out with the slightest turn of my head. And you're very sick to your stomach. If you're not throwing up, you know, you're weak and you're tired from them all. And other people that have taken those types of meds, including the Remicade, they've all noticed a difference within the first month minimum of feeling better. And I was on them for, you know, 4 months with not even the slightest touch of improvement. And so for them, that's how they knew it was working, is because they noticed relatively quickly there was a change, and it worked for them, and it was worth it to deal with the awful nausea and tired and achy feelings. But for me, 4 months and no sign of it working, it's not worth the harm that it was doing to my body to stay on them. I feel more along the lines of it's more undiagnosed autoimmune disease. Whether it's the SAPHO or not, regardless, medication for it isn't working. So, you know, at that point, a name doesn't matter, because what is there to treat it with? You know, the neuropathy part of it is mind-boggling to me, just because it never entered my mind as a possible illness for me. And so to combine them, it's, yeah, I've got an undiagnosed rare form of autoimmune disease along with neuropathy in the ribs, which is rare in of itself. And so I don't think, I mean, deep in the back of my mind, I think maybe there is still infection in there. And, you know, maybe there is, but nobody's going to do anything about it anymore because nothing's showing up. And so I kind of have to move on and go, okay, so we're still fighting what caused all of this 11 years ago. What is that? And how do I treat it? How do I stop it? And that's been the fight, is treat the neuropathy and figure out what happened 11 years ago and how to treat it.